We are delighted to announce that this year we're taking some of the Good Friday Appeal funds into the regions. It's a really exciting day for us as we take the world-class Children's Hospital excellence out into the regions.
And this important funding will support equipment, training and scholarships to support the regional healthcare systems. It will ensure that kids can get care closer to home, build capabilities in the region, and we're just thrilled with the impact that this is going to make across the state. So a very big thank you to everybody.
To all of our supporters. Thank you.
Teddy was born at 23 weeks, so really small. He was about the size of my hand when he was born with his twin. He left his twin behind at the women's and he came here, and then lots of issues with breathing and those things, and eventually they put in a tracheostomy under here, and he breathed through a tube in his throat about there for actually until 6 months ago.
He was born with cystic fibrosis at 3 weeks old. It's a genetic chronic illness that affects his respiratory and digestive system. So yeah, he needs around-the-clock care.
Ava has a rare disease, maple syrup urine disease. So we've been through the children's since she was born, and we were detected with her a disease by the newborn screening test, the blood spot heel prick test that they do. So she lives on a strict low protein diet for life. So we see the metabolic team here at the children.
Maisie's got a condition called lymphatic malformation, and we have a lot of procedures done here, a lot of imaging, and we work with her specialists, her team of specialists here as well.
Dom has a few things. He has primary ciliary dyskinesia, which is similar to cystic fibrosis, and then he also has a number of other comorbidities that go along with that.
So this year, for the first time, the Good Friday Appeal funding is going to be shared with regional hospitals. How is that going to affect you?
It's fantastic. We have 3 older children, so that means that I can be close to them as well and not 2 hours away. And yeah, we won't have to travel down here as much. It would just help us, our family, a lot.
Like, we had 24 appointments in the last 12 months, and it's a lot. So being able to go somewhere a little bit closer to home is a benefit for us and for, I guess, everyone out in our area too. It'd be amazing.
I think that's really good. So we always try to go to the Shepparton Hospital as our first point of call together, and obviously just get managed by the team here. So being able to have that extra funding there will make a world of difference, definitely.
I think it would be really great to see us not having to travel. Travelling is really hard. It takes lots of time out. What I'd love to see is improved communication between the hospitals, that the Bendigo Hospital staff would be able to work together with RCH so that way we can see that the way in which things are managed, that information, that expertise can be really shared so that we can be at home.
We would go to the Geelong, but often we'd have to come, bypass it and come here for care that he couldn't get there, or it's not a specific hospital for kids, so some of the things were lacking that he needed there. So that would be game changing, really.
No, sometimes she enjoys coming to visit. She gets really excited about seeing the doctors and the nurses, and then sometimes it can be a little bit scary, but they usually make it fun.
They've been so helpful. Ollie's been in and out of hospital multiple times since he was 3 weeks old.
Yeah, it was tough, but I think I tell the people that work here, there's no other place where everyone cares so much about what they do.
I think we're so thankful that the people here are so kind and generous.
Not rushing.
They don't rush, they've got the time. It's really personal. We just love this place, don't we?